Hello everybody. Well, it's springtime and I'm wearing a tie for the first time in more than a year. I've got my hat on. It's kind of a springy summer hat. It just seemed like a good day to, the sky is pretty, lots of sunshine, some clouds, but lots of blossoms out there on the trees, so it's a good day to dress up for spring. So I want to talk today about breakthrough infections. Breakthrough infections. We know that there's a lot of concern about it right now. A lot of talk, and so I thought it might just be valuable to try and go through the facts as best we know them. So the message today is pretty basic. Remember that no vaccine is perfect. No vaccine can give 100% protection to everybody. It just doesn't occur that way. Some vaccines are extremely good. The COVID vaccines fall into that category, but it's never going to be 100%. So there's always going to be some breakthrough infections. Fewer with some vaccines, more with other vaccines, but they're going to occur. So what's a breakthrough? Basically, it's an infection that occurs in someone who's been fully vaccinated. And if we want to be a little bit more specific about it, with the Pfizer and Moderna, you go one vaccine, second vaccine, and then 2 weeks, and at that point, you should be at the peak of your immunization from those vaccines. So we'll talk about breakthrough as anything occurring after that 2-week period, or 2 weeks after that one-dose Johnson & Johnson vaccine. So that's what a breakthrough infection is. I think it's important to remember that we're all different. What gets reported are averages, but each of us is a little different. Nobody gets exactly the same immunization level, if I can just use that term. So let's look at the influenza vaccine. It's a really good vaccine, but still people get infected even though they got the vaccine. I'm a perfect example of that. A couple of years ago, Carol and I, my wife, got the vaccine, as we always do, and then a few months later, we were actually at one of our favorite sushi restaurants, sitting at the sushi counter. And we got talking to the owner that we know, and she told us that she's had to send a number of her staff home, particularly the chefs, because they had symptoms that sounded like influenza. So she said, just go home, don't hang around. Well, just a few days later, we both woke up 6 o'clock in the morning, and we knew exactly what we had. Fortunately, we could get to our doctor quickly, get the Tamiflu right away, but still, we were sick. We did not feel good at all. So that's a breakthrough infection. And we're pretty sure, we don't know for sure, but we're pretty sure we know just where we picked it up. So the influenza virus, the influenza vaccine, is in most years somewhere between 40 and 60% effective, meaning that there's still a good number of people who can get infected if they get exposed. Still, we consider the influenza vaccine extremely good. Good because if everybody or most people get the vaccine, it does stop the circulation of the disease in the community. So back to the breakthrough infection. Again, the concept is that even though you've been vaccinated, you can still get infected. The good news is, usually, but not always, usually a breakthrough infection is relatively mild. And that's a good thing. So it is very important to get vaccinated, of course, because even if you do have a breakthrough, it'll probably be relatively mild. I'll show you a couple of exceptions later on. Now, the COVID vaccines are very, very effective. In fact, I think it's fair to say that I'm sure the people who developed them had great high hopes for very effective vaccines. But these are especially good. Remember that each of the ones that came out were good at preventing mild to moderate infection, with some exceptions, and there were no hospitalizations and no deaths. No hospitalizations, no deaths. And that, I don't know about you, but that's what I care about the most. So they really are very good. William Schaffner, Dr. Schaffner, at Vanderbilt University, real expert in vaccinology, and a terrific physician, called these vaccines spectacularly effective, and they really are. So let's look at the Pfizer vaccine for a moment. So we know from them that it largely prevents asymptomatic infection and it reduces transmission. Now that's new information. This has come out recently and very important because I think you've probably heard that one of the concerns about if you're vaccinated, can you still get an asymptomatic infection, not know it, or if you got it and not know it, can you transmit it to somebody else? So the information so far is that it's looking pretty good for the Pfizer vaccine. And if it looks good for the Pfizer vaccine, can we say it's going to be the same for the Moderna? Maybe. It uses the same basic technology. Johnson & Johnson? Don't know. Anyway, the information will come out over time. So it's somewhere around, and we're taping this on April 15th, so somewhere around 70 million Americans have been fully vaccinated at this point, double dose Pfizer or Moderna, or the single dose Johnson & Johnson, now again 2 weeks afterward. So there's only been a few thousand breakthroughs, but I have to put the statement up there, so far. Because remember, none of us have been vaccinated for that long a period of time, a few months at best. So let's go back and look at those original phase 3 clinical trials that some of the companies did. Again, I'm going to focus on Pfizer because we have the longest data points right now. So Pfizer, well, let's look at all of them for a second. Pfizer, remember, it was 95% efficacy, 95%. Moderna, 94%, hardly different, really. Johnson & Johnson, 66%. It looks less, but there's some reasons why it may have been less like that. And the AstraZeneca and the Novavax vaccine, although there's data from England and elsewhere, we're waiting for the data from the United States to come through, because the reason why that's an important statement on my part is that the Food and Drug Administration has exactly the same criteria for each of the companies to follow, and same criteria for what constitutes a mild infection, a moderate infection, a severe infection, and so on. So everybody, it's equal. Equal, I guess is the word I want to use. So in those initial clinical trials, we now have, as I mentioned before, updated data from Pfizer that says that when you go out for 6 months in that group of people who were vaccinated, it's still 91% effective. 91%, that's still very good. So let's look at the specifics though. And we want to look just at Pfizer because that's where we have the long-term data, or longer-term data. So just a reminder how these trials went. 44,000 people were enrolled, volunteers. Half got the placebo, half got the vaccine. So that's around 22,000 on each side. Then they were followed to see who got infected. So at 2 months, more or less, which is when the data was submitted to the Food and Drug Administration back in December, the placebo group had 162 people infected, whereas the vaccinated group had 8 infections. So 162 and 8. Now at 6 months, following them up for 6 months, it's 697 have gotten infected in the placebo group and 50 in the vaccinated group. So why focus on this? Well, basically what we're seeing here are breakthrough infections. At 2 months there were 8, and at 6 months there were 50. Numbers are small, certainly a lot smaller than the placebo, but they still had some people getting infected. And I think that's really the important point. I think that for all of us who've gotten the vaccine, we feel like, hey, we're bulletproof. Well, it depends on how hard the bullet hits or where it hits. We're not perfectly bulletproof. We're certainly much, much safer than we were before, but there's still a chance to get infected. Now, most of these breakthroughs have been mild, but there have been some serious ones. So let's look at Washington State. At a time when they had vaccinated about 1.2 million citizens in Washington. They saw, over some time afterward, but not a lot of time, a few months, 102 breakthrough infections. Well, that comes out to be 0.01%, so pretty low, pretty low. Unfortunately, though, well, I should say mostly were mild, but a few required hospitalization and 2 died. So the breakthrough infections can be severe, usually are not. It's really uncommon to have a severe one, but it can occur. Now in Southern California, near Los Angeles, in the Los Angeles area, 2 big healthcare organizations, each associated with universities, UCLA and University of Southern California, have a lot of healthcare providers at all levels, physicians, nurses, pharmacists, and so on. And they got into a program where they were doing testing of everybody, or not everybody, but a subset of everybody, on a weekly basis. They then also started getting the vaccines into people starting in late December. And so if we take, again, the definition of 15 days, 2 weeks after that second dose, who had a breakthrough infection, and that amounted to some 15,000 staff at those 2 medical centers, turned out that 7 tested positive, 7. That's a pretty small number. It's half of 1%. Again, that number may come up if it gets followed out over more time. But at least for now, we can say, yes, it occurs, but it's relatively uncommon. So it just turns out that this morning, the Centers for Disease Control, the CDC, came out with a new report. And they're very carefully collecting information on everybody that gets vaccinated. And then among those, among other things, who gets infected. And remember that, again, this was a few days ago that they put the data together of more than 66 million Americans fully vaccinated. That's, again, the 2 doses plus 2 weeks, or the 1 dose plus 2 weeks. There's some 66 million people that fit that category. And there have been 5,800 breakthrough infections. That's a pretty small number. Put it up there, 0.008. So a very small percentage. Anyway, they're watching them very carefully, saying this well, they're watching very carefully to see who else might develop them, and over time will there be more of these, because that's just not known at this point. Well, what's it all about? Why are people developing these breakthrough infections? I think the answer is murky. I don't know, I couldn't think of a better word than that. In other words, we don't know. So I just put up murky. Certainly, we know that older and immunocompromised people don't necessarily generate the same immune response as a younger person. Although, with the coronavirus vaccines, what was seen was the antibody levels came up nicely in older people as well as younger. And according to the data they presented to the Food and Drug Administration, you could subgroup divide people by age, older, middle-aged, younger, by gender, by ethnic background, and so on. And it just seemed like it worked equivalently well with everybody. So, yes, older people may not respond as well, but it seems like that's not the answer. But again, time will tell us a little bit better. Now, the next thing to think about is, what about you got a huge dose of the virus. I don't know how else to say it, but a big load. Maybe you were in an elevator, and there was someone on that elevator who was infected, maybe didn't even know it, but was a heavy-duty shedder. And there you are without your mask on the elevator, and poof, you got a big dose. That might just be so big that it overwhelms your body's immune ability to fight the infection off, even though you were vaccinated. So that's a possibility. A third possibility is the variants. We know, you've heard the ones from England, the UK variant, the South African variant, the Brazilian variant, and there'll be more. and we know that some of these are more transmissible and perhaps even more pathogenic, meaning more able to cause infection. So if that's the case, is that why people are getting breakthrough infections? So the CDC is very carefully trying to get everybody who has a breakthrough tested with a swab and to see what are they infected with the original strain of the virus or one of these variants. And so time will tell us the answer to that. Right now, as I said, we just don't know the answers. You know, what I'm finding in checking around is that people who develop these infections frequently have no idea where they got it. Absolutely, they're totally surprised. They just don't know where it comes from, and the reasons just aren't clear. So I think for right now, we're going to have to say, we don't know enough to know why some people have a breakthrough and some people don't. But it does say, since we don't know, that we all have to pay attention, all have to be cautious. And I'll more detail on that in just a minute. A little bit more about the variants. These authorized vaccines are actually quite good, if not very good, against the variants, at least so far, the ones that are out there. Because here's one of the things that happens. With the vaccine, for most people, the antibody level comes up really high. And so even though a variant may, I'm not sure how I'm going to say this right, the variant may come along and it may be able to be more resistant to the antibody. There's a high enough level of those antibodies that it still wipes it out. So I don't know that that's going to prove to be the answer, but you know, again, time will tell us and we're going to find out. So, you know, maybe, the variants are going to prove to be the answer. I kind of doubt it. I think there's going to be a number of reasons why. And I think it's probably going to be because different people respond to the vaccine differently. And so that's just, I think, what's going to happen. Anyways, I mentioned most people can't determine where they got it, where they catch it. And again, it tells us that we have to be cautious. So what does caution mean? Well, actually, I should start with, should you be concerned? Does what I'm telling you, what you're hearing on the media, concern you? It shouldn't. It shouldn't. But you got to be cautious. You have to protect yourself. And how do you do that? You wear a mask. You social distance. Don't go into crowded areas. Don't go into an area where there's limited air exchange, not airflow, but actual air exchanges. I used the elevator example a few minutes ago. You know, that's the ideal place. There can't be much air exchange going on in there, and it can be crowded, both. So, yes, you got to take the elevator sometimes, but you still want to take an elevator without too many people on it, and you want to wear your mask and keep some distance from the person in there. So again, remember, this is a virus that's spread via air, via our breathing out and breathing in. Not too much by touch. That doesn't mean you shouldn't wash your hands. You should. But the real focus is right here. Keeping a distance from people and putting a barrier up. Both my barrier and your barrier. Absolutely essential. Now, here at Charlestown, I think it's very fair to say we've been exceptionally fortunate. Because of what the management and staff put in place starting a year or more ago, it did a lot, very lot, to protect us. We've had relatively few infections, especially in independent living, and we should all be very thankful for that. Yeah, you know what it meant? It meant we didn't go to the restaurants, we didn't have meetings, we got bored, we got frustrated, we got angry even, but we survived. We didn't get infected. So for that, I think we owe Charlestown, all the folks who work here, a huge thank you. They've worked hard. They came to work every day while we stayed home, if you will. They brought us food. They brought us our stuff. They did what they could to make sure that we were taken care of. And it's made a difference. It's made a huge difference. So now we're starting to break out in the sense that we can get together a little bit better because we have been vaccinated. But just remember, we're not out of the woods yet. Not enough people have been vaccinated across the country. The virus is still out there. It's a nasty virus. It wants to get to us. It will if it can. So we've got to be careful. So back to what I was saying, keep our masks on, keep a distance, avoid the crowds, avoid the low air circulation areas. And you know why we're doing it? We're doing it to protect ourselves. You don't want to get infected. I don't want to get infected. We're doing it to protect ourselves for sure, but we're part of a community, and we need to do it to protect everybody else in the community. So thanks for watching. I appreciate it.